The frequency for doing a central line dressing change is based on hospital policy. First, I would begin by gathering my supplies. I would need a central line dressing change kit or tray, non-sterile gloves, a mask. I will enter my patient's room, wash my hands, introduce myself to the patient. While looking at the identification bracelet, I want to ask my patient to state his name and date of birth. Then I will explain the procedure to the patient. I will pull the curtain for privacy. I'm going to lower the side rail and raise the bed to a workable, comfortable working position. I'm going to open my kit. I want to open this away from me. I will remove the mask and place on my patient. If the patient can tolerate wearing the mask, that's fine. If they cannot, I will ask the patient to turn his head to the side, away from the central line. I am careful only to touch the outer 1-inch border. Now I will place on my non-sterile gloves and remove the old dressing. I will pull down and away. I am holding onto the lines to keep them secure, and I am careful not to touch the insertion site. I don't want to contaminate it. I want to assess my site for any signs of infection, redness, swelling, drainage, inflammation, warmth, or crepitus in the surrounding area. I will remove and place my sterile gloves on. Taking my ChloraPrep, I will open it. I'm going to pinch the wings. If there are pieces of dried blood around my insertion site, I would take my ChloraPrep and wipe away using a different part of the ChloraPrep with each wipe. Then, using a second ChloraPrep, I would begin my cleaning or scrub. Scrub vigorously for 30 seconds in a back and forth motion. I will discard the ChloraPrep sponge, allow the area to dry. I don't want to blow on the site or fan it to make it dry, just allow it to air dry. Now I will apply my Tegaderm dressing. Note at the top there's a label that I will write time, date, and initials when I'm finished. I'm going to be careful not to tear this when I apply the Tegaderm. I will start at the top and peel it apart. I will place over the catheter, careful to smooth any wrinkles. And then I will peel the rest of the dress wrapper away. Making sure to tap down the edges to secure it. Now I will place the label on the dressing. I'm going to place it over the edge so it's not covering the insertion site. Now I will remove my sterile gloves, cover my patient, remove his mask. remove my mask, place my side rail back up, lower the bed to the lowest position. I will dispose of my supplies and wash my hands.